Good morning. This is Dr. Stephen W. Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this beautiful Wednesday morning. Okay, it's a little foggy. It's going to rain a bunch, but it's still a beautiful day. Good day to be alive. Thanks for joining us via the Facebook or the YouTube broadcast this morning, or just listening in. We're delighted to have you. Today, we're going to be talking vaccination. Not just for COVID, but for the flu as well. And while millions of people have gotten at least one shot for COVID, it's more important than ever this year to get the flu shot as well. We'll show you one campaign aiming to get the message out that both shots are safe. We'll check in with Dr. Daniel Hawkinson, Medical Director of Infection Prevention and Control, in just a moment. He'll be back into the studio. He's dropping his kids off at school. What a good guy. And he's going to give us the numbers when he arrives. And when he and I are here together, we're going to be doing a pretty cool thing. We're going to repeat from last year, flu shots on the air. But first, do we have any reporter questions out there?
Sure. Good morning. Cody Holyoke with Channel 9.
Cody, good morning.
Hey, morning. CDC came out today, or early this morning at least, we were reporting, urging a booster, coronavirus vaccine booster for people with weakened immune systems, which
yes,
I guess counts up to 4 shots.
Yes.
Your thoughts on this, and people were calling it another booster, and I know that you guys refrain from calling it that, but
yeah, it's not. We'd like to confuse the public just to make things completely cloudy. But the reality is, I think you may have heard us say before on the program, and we've been saying to our patients in the outpatient clinic, that if you're a transplant patient or if you're on somebody who's really immunocompromised, like with chemotherapy or on a lot of drugs to suppress your immune system, we know that you're not going to respond to 2 shots. And so really you need that third shot to obtain about 60 to 70% efficacy. What the FDA is now saying is, look, we've got enough experience that we still want these folks to get a booster as well as 3 shots, so they get a 4th shot in that series. The question is still out a little bit about whether you get a full dose or half dose. I was trying to read about that this morning as I saw the same thing you did, thinking, okay, how are we going to explain it? But I think it's a 4th in a series for people who are really immunocompromised. So you're really going to get 4 shots. And that's really spread out now over a total of about 8 months. So you'd get 1 shot, a month later you get another shot, a month after that you get your 3rd shot, and then 6 months after that, is that 7 or 8? That's 8. 6 months after that you get your 4th shot. And then the question will be how many shots after that, and we don't know yet. So I think it's the right thing to do. I think especially in the transplant population where a lot of the data was coming out of, we know that people really weren't as well primed with their immune systems after only 3 shots, so 4th shot is probably going to go. And so, actually, this is pretty convenient because we have Dr. Bridgette Jones, who's an allergist over here from Children's Mercy Hospital. And, allergists and immunologists, they know a lot about this stuff. So what do you think about that 4th shot?
Yeah, I think I agree with your explanation of, why this is needed for patients that are immunocompromised. You're exactly correct that in patients that aren't able to mount what we would consider a normal immune response, they're likely going to need additional vaccination to achieve the same level of immunity of someone who does have a normal immune system. So it does make sense to call this more of a series. These patients may just need a different series versus patients that do have a more normal immune response.
Yeah, so I think it's really important that folks like that get that 4th shot. Go ahead, Cody. Sorry.
No, it's fine. Since somebody from Children's Mercy is here, I'll ask, since it seems like the approval for the Pfizer vaccine is a done deal for kids 5 to 11. Can you kind of peel back the curtain for us on what's been going on behind the scenes? I know for weeks Children's Mercy and KU have been kind of preparing, but what's going on, especially as this feels like an imminent thing?
Bridgette, I know you guys have to be ready.
Yeah, we definitely are. I think we've been ready for some time, especially, knowing the impact that COVID-19 has had on children from multiple levels. And so we've really been anticipating the availability of a vaccination for children. So we are, getting ready and willing to vaccinate children as soon as the CDC says so. Yesterday the advisory board provided the recommendation to the FDA to grant the emergency use authorization for the 5 to 11 group. And so next, the CDC will of course have to sign off on that. And as soon as that happens, I know that Children's Mercy and as well as our community pediatricians and pharmacies are willing and waiting to provide that vaccination to children and their families.
I kind of just follow up, because I want to also introduce Dr. Catherine Satterwhite, who's the regional director for Health and Human Services here in Region 7. So you guys have been having to do a little work too on this whole question of those from 5 to 11.
Yeah, Dr. Jones bridged it for me perfectly. From a larger perspective, now that we do have some good news that it looks like the 5 to 11-year-old Pfizer vaccine will be authorized soon and then recommended by ACIP and CDC. The U.S. government is actually shipping millions of doses across the country to have that vaccine located in places that parents already know and trust so that they can get that vaccine when it is made available after CDC recommends. We know that parents are most comfortable talking to providers, to their doctors that they talk to every day. So that is the main way that we're going to promote getting that vaccine.
Yeah, and I think this is a huge deal because even there are a couple of things, right? First of all, vaccination does feel like it reduces the risk of spreading even the Delta variant, perhaps by about 50%. And so if we want to help prevent the spread as kids become more and more social and then help prevent it from going home, we need those kids to be vaccinated. So I think, if we want to seek this return to normalcy, I'm sure not wearing masks in school would be another way to feel more normal. I think I'd feel a lot better about that, Bridgette, if people didn't have, or if the kids had all been vaccinated.
Yeah, definitely. I think that, this is an extremely important step for children to provide that opportunity for them to get back to some normalcy. This has been a very tough time for everyone, but especially children. And I think that, many times we forget the impact that this is having on children, just the little things of being able to go to a birthday party or a sleepover and feel comfortable among your friends, to be with family during the holidays. Those are the types of things that, as more and more people get vaccinated, especially children, we'll all be able to do and be more comfortable in our day-to-day lives. So this is a really, really important step for everyone.
And just to say, are you comfortable with the 1/3 dose? Because I think that's probably great. The data looks pretty strong.
Yeah, I think the data look extremely strong. The committee reviewed the data yesterday, and the data demonstrates that a 1/3 dose is very effective in children in preventing serious disease, and that's the goal, that we want to prevent children from getting COVID, getting very sick from COVID, certainly being hospitalized or dying from COVID. And so, there's a balance between providing an effective dose plus a safe dose, and that's what the data showed yesterday within the review committee, that we do have a safe and effective vaccine for children.
And just to say, it was a 17-0 vote with one abstention. So pretty strong vote there by the committee.
Yeah. Very, very strong, I would say. And so I think that should give everyone even more confidence that this is a safe and effective vaccine for kids.
Cody, other questions?
Good, thank you.
Hi, this is Jordan from Channel 41.
Hey, Jordan.
Hey, so I have a question. My question really is, we are honestly getting a hard time people getting that second dose. Do you think it's going to be harder to get people to get this booster, and talk about what happens if someone does not get the booster eventually?
Yeah, you bet. So what I would say is this. First of all, about 90-95% of people who get their first shot are getting their second shot. So I think if that population of folks, I expect most of them to come out and get a booster. Some people may wait a little while longer or whatever, but I bet most people are going to get a booster. Honestly, this is actually a fairly complex question. And that shouldn't be actually. I didn't make you think that sounds really badly the way I said it. I apologize for that. But it is a complicated question because I think it depends on a couple of things. First, did you get the J&J vaccine, the Pfizer vaccine, or the Moderna vaccine? Because, I think the story is a little different. If you got the Moderna vaccine, that data is really strong at 6 months. Recommending it just to make sure that it's in step with others and to help prevent viral transmission. But the information about the Moderna vaccine shows that it's really pretty darn strong at 6 months. On the other hand, Pfizer is good, but it's down a little bit. And then there's J&J, which isn't perhaps quite as good. And so I think that the right thing was to go ahead and issue a recommendation for each of the vaccinations to get a booster. Because remember, our goal with the booster isn't, of course, it's to help prevent severe hospitalization and death. But the truth is that those who are vaccinated, unless you are really immunocompromised, all 3 vaccines are still doing a really good job of that. What we're really trying to achieve is reduction of viral transmission so that you're going to have 2 things. A, less spread of the Delta variant, we're hoping. We think that's going to be true, and more and less people turning positive, and therefore less spread of the Delta variant, and maybe even a better outcome with hospitalization and death, although it's still quite good. So my guess is that I think most of the people who have been vaccinated with the first 2 shots will go ahead and get their 3rd shot, and just watch next week for some special events with Hawkeye and I. What do you think?
Well, one of the most important things about those booster recommendations is the possibility to mix and match too.
Yes.
Giving people an opportunity to maybe have an informed decision about the type of shot that they're getting oftentimes in conversation with their doctor or another trusted professionals that they're getting at. And it's a great question about thinking about who's going to get their booster, but I just want to also make sure to note, as I know Dr. Stites has talked about all the time, that it's really most important that people who haven't gotten any vaccine doses continue to seek out those vaccines and the information that they need to hopefully make a decision that would lead them to getting vaccinated.
Thoughts that you have as well, Bridgette, about this question?
Yeah, I agree. I think I agree with your point that it's extremely important for those who haven't been vaccinated at all yet to really consider taking that step. I also think that, this is could be a very personal decision that you make with your physician. So please, in thinking about getting that booster vaccination and what's the best step for you, please reach out to your primary care healthcare provider, talk to the pharmacist to help you with making that decision.
And I would say, especially if you've had, there is some question about if you've had the J&J vaccine, that next booster may be one of the messenger RNA. So that's really where the mix and match, the most important thing is coming from. And the same thing's true on that 4th dose, just to come back to that question of immunocompromised. I think you made a great point, Bridgette. Talk to your physician. Anybody with any kind of significant disease, chronic disease, talk to your doc and see where they're going to land with you about should you get 3 or 4. And by the way, you're going to mix and match those 3 and 4 if you want to as well. And your physician will have some recommendations for you about that. Other questions?
And just my last question is for you guys is the immunocompromised you were just talking about. I think people who are needing a transplant, they're scared of just the common cold. So, this has got to be a big deal to eventually get that 4th shot for them. I guess, can you explain that a little more about how scared these people really are just to catch something that's so small?
Yeah, I think I think you're right. The transplant population and those people with chemotherapy or other advanced rheumatologic and allergy pediatric diseases who are pretty immunocompromised on lots of medications to suppress their immune system. I think this population, it's an interesting population. I'm going to talk about the transplants for just a minute. They live in fear of infection all the time. What's interesting is that same population generally has the best behaviors because they've been taught since before they were transplanted, they have to have the best behavior to survive. So they're already wearing masks. They're already wearing their hands. They're already social distancing when there's stuff going out because they know that they're always at risk of some infection causing them trouble. And I had a few years ago, we had this wonderful young man who was about 23 years old, gotten his lung transplant for CF. He had gone jogging on a Friday 3 miles, and by Monday he was on a ventilator, hospitalized with serious, and he never recovered. And it was because he got an adenoviral infection. And so transplant patients are a unique subset. So I think transplant patients have been a little more fearful than most about COVID-19 because they know they wouldn't particularly do very well with it. But I also think they knew how to behave around infectious diseases better than almost anyone because they've been taught how to do that for so darn long. And so I think that population will, by and large, embrace the 4th shot. In fact, I'm already getting phone calls. How soon can I get it? You got to wait 6 months. So, yeah. Other questions? Okay, so now I have a question before we move on, because the one thing nobody asked about is a really big deal, and I'm going to come right to you about this. Molnupiravir, did I say that right? The new Merck pill, they're going to supply it to countries with, low income countries much, much cheaper, because they're going to give the pill to generics to make, and they're working with the United Nations. That's a big breakthrough. Catherine, talk a little bit about that. You're the pop health expert.
Well, I think so. First of all, that the data from that trial were exciting, and it's the first time that I think we have a really viable outpatient treatment
Oral
option,
three,
right?
yeah.
Oral therapy, great.
So just to tell everybody, it's a pill that you take, just like you would take the drugs for the flu, Tamiflu. Thank you. And you take twice a day for 5 days, and it helps reduce hospitalization and death by 50%. So a really big deal.
Yeah, and it's actually also, so it's a big deal in terms of equitable access, not only globally, but also within our own country. We know that there are people who may not access monoclonal antibodies, which we've talked about for a long time, but they might take an oral pill. People do that all the time. It's easier to get. You don't have to go somewhere to get it. You can get it at your pharmacy, all sorts of things. So I think it's really exciting, and I'll look forward to seeing how that will be distributed when we get to that point.
Yeah, I think that's a big deal, and I was so happy to see that. But there's an existential question here. The U.S. folks are going to be paying about $700, $750 per dose, and most of us will have insurance, or a lot of us. But then there will be a sliding scale for people who don't, I think. And then in poor countries, it'll be about $8 per course of therapy. So, yeah, there are some existential questions about healthcare across the globe. And probably won't get in that one today. We'll bring Catherine back for another program and talk about it then. Okay, so as COVID-19 cases have been declining, another virus that health officials are keeping their eye on is influenza. We had a mild season last year, but we don't know if we're out of the woods or not. I know Hawkeye watches and he's back with us today, and we'll turn to him in just a moment. But I've been tracking that. The CDC has that influenza tracker, and you can see the case count. So far, Hawkeye, they're staying pretty far down.
Yeah, absolutely. As far as the southern hemisphere, which we track, for instance, South Africa, Australia, Australia had just over 500, I think, total diagnosed cases for their influenza season. We lag behind them in our influenza season, but just as you said, right now there still is overall low amounts of activity in influenza.
Yeah, it's pretty good. What are our numbers today, Hawk?
Today we have 21 active infections, with 9 in the ICU and 5 on the ventilator. 4 of those active infections are fully vaccinated. But again, it's not clear if all 4 of those vaccinated people are here because of COVID or for some other reason. We still have 25 in that additional recovery period, so a total of 46. But
yeah,
the actives are staying right there.
They are. And so I think with that, folks, don't get cocky, because we know that last April we were down to 3 patients, and now we're still at 22. We got into the 14, 15 range. We're back up into the low 20s, and we've been holding steady there for over a week, 2 weeks almost. And so I think we have to think very clearly about this. We are not out of the woods, especially as the cold weather arrives. People go indoors, masks come off. We are not out of the woods. Be very careful. Okay, so while it is not as deadly as COVID-19, influenza is blamed for an average of 33,000 deaths and 419,000 hospitalizations per year in America, according to the CDC. Now, again, COVID-19 has overwhelmed those numbers, so don't anybody think that COVID-19 and the flu are the same. But flu shots taken by both the vulnerable and healthy Americans prevented more than 100 additional hospitalizations and 6,300 additional deaths in 2019, our last really significant flu year. Leading by example is one way to help encourage more vaccination, as well as having crucial conversations like the ones we're going to do today. So both Hawkeye and I today are going to do something special. So stick around, as some of us will get our flu shots in just a few moments. We're going to talk a little bit more now with Dr. Catherine Satterwhite and Bridgette Jones, and also we're going to talk with Mark Logan, the founder and chief collaborator of, okay, Mark, you're going to help me here. Is it Idealect? And
That's exactly.
did I say it right?
You did.
awesome. He's also a communications director for Comeback Kansas City. So thanks, guys, for everybody joining us today. Dr. Satterwhite, let's start with you. Bring us up to speed. How are vaccinations progressing in Region 7, and how is HHS gearing up for COVID shots for kids? We've talked about that a little bit, so let's talk a little bit more about influenza now.
Okay, yeah, let's do it. So first of all, I'm excited to get my flu shot today too.
That's right. There's three of us that are getting it.
There's three of us. I feel like
I messed that part up.
I'm crashing
The
your
script
party.
said 2 guys. I think it said 2. Did it say 2? I don't remember. Okay, fine.
Anyway, that's okay. I do think it's really important. So one of the things that we've been sort of talking about at HHS is, and this is not the first time we've had these conversations, right? Is again, how do we sort of get to a place where COVID-19 is with us? We know it's with us to stay. And integrate it into what we already do. And one of the important things to do is get the flu shot because it's a respiratory virus. We know that it's respiratory virus season. I mean, I'm sure you continue to see a lot of RSV in kids. Yeah. So we want everybody to get their flu shot. And it's important for all ages. So I don't know if you want to comment about RSV, because I do think that it's COVID, it's the flu, it's RSV.
Yeah, definitely. In kids, we've been seeing RSV and flu, even through the summer, which is very unusual. And so I think that just speaks to the even more importance for everyone getting vaccinated, because we don't want to be hit with all of these viruses at once this winter. That's the thing that we really need to try to avoid. And I think that especially, like you said, going into the winter, people are going to be indoors. Holiday season is coming up. People are going to want to mingle in their homes and maybe take their mask off. And so I think the best way that we can make sure that everybody is protected is getting vaccinated for flu and COVID, making sure that everyone is covered this winter.
And Bridgette, just to follow up, have you seen a lot more asthma outbreaks now? Because I know, that's what you guys spend a lot of time taking care of asthma patients.
Yeah, it is starting to tick up. We did have a period where asthma flare-ups were really low. Asthma exacerbations in the ED were really low, and I think that was a lot due to the fact that kids were wearing masks a lot. People were staying home. But, as you mentioned, it does feel like we're getting into this kind of comfort zone where we think that we're out of it. And so masks are coming off. People are socializing indoors a lot more. And so with that, we have seen that asthma exacerbations in our EDs, in our urgent care, even children that come into my clinic that I see just for regular checkups, they're now, their asthma is more uncontrolled versus controlled. Kids that I was seeing back in last year when everyone was kind of staying home. And so I think that speaks to even more the reason to get vaccinated, because we know that the flu can trigger your asthma. And so we need to protect those kids, especially that have conditions like asthma, where they could get a really bad flare-up and be in the hospital from their asthma if they get the flu.
Yeah, I think that.
One additional comment, just because I think it's important to remember that the flu shot has been around for many, many years, and there's a reason that we recommend it every year. Like the COVID-19 shot, it reduces your risk of hospitalization and death, just like the numbers were highlighted at the beginning of the show. So as we get to a place, so the flu is a vaccine preventable disease. COVID-19 is a vaccine preventable disease. And we have those tools. So everybody, please consider using those tools and making your life a lot safer.
So, Mark, we've asked you to join us today to talk about efforts by Comeback Kansas City to increase vaccinations among some of the most vulnerable populations. Explain to us exactly what you're doing out there, what's your campaign like, and talk to us a little bit about the success you're having.
Yeah, thank you. I'm very glad to be here. I'm especially glad to be here with Dr. Bridgette Jones, who worked with us on this campaign. We looked at some of the research, and Dr. Satterwhite alluded to this earlier. Research tells us that doctors are the most trusted voices in this sort of ongoing public discourse that we're having about the COVID-19 vaccine. So the other thing that we know and has been abundantly clear throughout the pandemic is that not all communities within the larger community are being impacted equally by COVID-19. In particular, in the Black and Latino communities, we've seen higher rates of death and hospitalization. Those communities have really been hit hard. And there are a number of reasons for that. I won't unpack all of those. But what we really wanted to do is elevate the voices of some of our Black and Latino physicians here in Kansas City to help them talk about their experiences with vaccination, answer some of the questions that people routinely have, and talk about some of the advice and considerations that that they give when they're talking to their own patients, to simulate as much as possible, if you will, that patient-doctor communication, and overall the message. And I think you may have said this earlier, Dr. Stites, is if you have questions, if you have concerns, talk to your doctor. They are the single best authority, most trusted voice in this dialogue. So that's really it. We went out and we filmed a number of physicians locally. We have been sharing their video clips on our website at Vaccinate KC, and on YouTube, Facebook, and Instagram. And we're just trying to get the word out, and as I said, elevate the voices of those doctors.
Yeah, I think that is really important. Dr. Jones, thank you for participating in that. Talk to us a little bit about how that felt.
Yeah, that, I'm really grateful for this organization for putting this together, because I think that, your discussion about equity is a really important one to consider. And I think we all know that the impacts of COVID have been extremely felt by Black and Hispanic communities across the United States. And so developing messaging and education that directly speaks to those communities, I think is really important, because people want to see other folks that, look like them, that have had similar experiences as them, and can also understand some of the apprehension that they may have around new vaccines, new therapies. Because as physicians and people in medicine and science, we know that historically, we have not always done everything right. And I think that we all have to be honest about that. And so those are conversations that I think are important for us to have with those communities, to be honest about, this did not go right, but this is what's going on now, and how we are making sure that things are being done in a safe way for everyone. And so I think that, it's understandable that communities have questions, and we just need to be there as healthcare providers and scientists to answer any and all questions that they have, so they can make the best informed decision.
Yeah, I think that is perfectly said. So how's the website doing?
It's doing great. We're getting a lot of traction on the videos. We have just started a paid media campaign on social media to get an even wider distribution. So we're looking forward to getting more eyeballs on those videos and getting those voices out there in the public and helping to shape the conversation.
And I understand it's also in Spanish, so that's got to be reaching a whole new population for us.
Yes, absolutely. We have both English language and Spanish language videos on the site. The website itself is available in both English and Spanish. And I'll just put in a plug for the website more generally. It's a great resource if you need to find information about where to get the vaccine, answers to common vaccine questions, reach out to the organization and get some help finding a vaccine or a booster dose. We are currently working on the two topics that you guys have talked about today, booster shots and kids vaccines, and we'll be unrolling content and campaigns around those two things as well.
Yeah, that's really important. And Dr. Jones, as we look at this whole question about the FDA and the COVID vaccination, we also know that the CDC advisory committee is going to look at it. So you'll first think that the COVID vaccinations, guys, when are they going to come out? What do you think for 5 to 11? When will actually be in a physician's office?
If everything goes as we expect, probably mid next week.
Okay, mid next week. Here we go. Yeah. Ready to get them vaccinated. Don't you think, Hawk? Right thing to do.
We need to. Yeah, I think it's good for helping reduce the spread of disease in households and social groups, and especially to those that are most vulnerable, but it's also good for protecting the children against long COVID, against multi-system inflammatory disorder, all of that stuff.
All right, well, this is the moment you all tuned into this program. This is why you really came in. Hawkeye, you're going to get a flu shot in just a minute.
Yeah.
Dr. Catherine Satterwhite, you're going to get a flu shot.
I am.
I'm going to get a flu shot. Have you already had your flu shot?
I've had my flu shot.
See? His fingers.
Jumping again.
Fine. Show us up. All right. Who's going to go first here? Let's see. What's what the script says. So who's going to be the first person to get their flu shots this week? I think we are going to introduce first Adam Meyer, who's one of our directors and someone who's been at the forefront of our entire COVID vaccination program. And so a special thanks to him. And I know that this is a big deal. We got to put our masks back on when they come over here. And also, I'm going to say her name correctly, Amory Lee. Did I do okay? Not bad. Emery's going to be coming over. She's got her special protective goggles. She's got her glasses. She's got her face mask. They're all doing it the right thing. We're going to put our masks on. We're going to get the flu shot. And while we're doing that, I'm going to keep asking Dr. Jones questions because we're going to have to take our stuff off. I just pulled my thing out of my ear.
As you're doing that, I would like to say, Dr. Satterwhite did steal a little bit of my thunder when she talked about influenza vaccine. The same is for COVID-19 vaccines. We know that those people that got influenza vaccine, even in those years where vaccine hasn't been a good match with the virus, it still had reduced rates of hospitalization and reduced rates of missed days of work. And so I think that's important. And as we heard, I was on a meeting earlier with her today too, as we heard from her today, there is an MMWR published report now, I think just within the past week, that shows that across ages, age groups, and sex, those people that were vaccinated compared to those that were unvaccinated had less risk of non-COVID death as well. So overall, the COVID vaccines are safe, very effective. Same thing with the influenza vaccines, and even can protect you from hospitalization and from things non-influenza related, non-COVID related as well.
All right, well, here they come. They're going to start with Dr. Satterwhite getting her flu shot to begin. Awesome. And while we get started on that, Dr. Jones, talk to us a little bit about what you see as the biggest concern for the winter and kids having to be back indoors.
Yeah, so I think it's really just that, of us all being indoors, and like I mentioned before, with the holidays coming up, there's going to be a lot more socializing, taking off your mask, and so, kids are at risk for COVID and they're at risk for the flu as well, and so I think we all just need to stay vigilant in this. Vigilant in making sure you're getting your vaccinations and also making sure that you're masking when you're indoors.
And so here comes a big moment. You get to see my whitey-tighty t-shirt on. But the one of the things that I think has to be an interesting thought for y'all, and I get puzzled by this too, we just saw so much less infection last year. And I think it's fascinating as you look back and think about it, how that really happened, why it happened. People weren't in the hospital. They were just getting, doing their normal stuff. Talk to us a little bit about that.
Yeah, it was really, something interesting to see. As I mentioned before, patients with asthma, especially, we weren't seeing those asthma flare-ups and asthma exacerbations during the winter. And so it is interesting how effective masks are in those types of situations for asthma and just for respiratory disease in general, and how even the social distancing likely contributed to that. And as we see people getting more comfortable and socializing more and taking off masks, we're seeing those numbers go back up.
Keep talking. I have to sit my jacket back up.
I have something to add, actually. So I just wanted to share this story because I think that there are people who will relate to this. So I found out I was going to get my shot on the show this week, but my kids got vaccinated this weekend. And one thing that my daughter has learned is that she's actually much more comfortable getting her vaccine in a pharmacy. She's 14 and has some needle phobia, some needle fear, and she understands the importance of vaccines, but has been able to tell me, I would actually prefer to get it there because I'm less nervous. And I know that there are a lot of people who are nervous, not about what's in the vaccine, but about the actual needle and about the actual process to get the vaccine. So I'm just putting that out there as an example of, there might be a situation that's better for you that makes you more likely to get vaccinated, and that one size doesn't fit all.
So as we get all our vaccines done here, thanks to Adam and to Amory, got it right that time, darn. Okay, to Adam and Amory for helping us with that. So appreciate your great work. This question about where to get the vaccination is important. How do kids seem to do in your office usually when you?
Yeah, I think, we have varied responses to vaccinations among kids. Some kids, I have two daughters. one child doesn't seem to bother her. She just sits there and gets the vaccine. The other child, we kind of have to chase around the room a little bit before we convince her. And so I think that's a normal response to needles in general. At Children's Mercy, we do have comfort measures for kids that we can implement when we do have kids that, have needle phobia. And I think your point to, getting the vaccine at a place where you're most comfortable is really an important one, to have that conversation with your child, prepare them before they go in and get the vaccination, explain to them, what's going to happen, and also discuss with them, here are the options of where we can get the vaccination done and where would you feel most comfortable. I think that's a really important point.
All right. Well, let's turn to Jess, because Jess, I bet there are a few questions out there. First of all, I get to congratulate you earlier this week with your daughter's outstanding video that won that kind of Emmy award. That was pretty cool there, my sonny. Well done. I would say in this case, the apple did not fall very far from the tree at all, just to say.
Well, thank you. I appreciate that very much. So we are getting so many great questions today. So I just want to let everyone know that we'll get to them today, tomorrow, and Friday, because I think you're in the rest of the week. So I want to try to get to some of these kid questions, and we're getting one that's kind of along the same lines. Susan says she has a grandson who will be 12 on January 4th. He's 5'8", 160 pounds. Should he wait to get the flu dose in 2 months instead of getting it right away? Catherine asking, can you explain why vaccine dosages are based on age instead of physical characteristics?
Isn't that interesting? Because the FDA just took this question on yesterday and talked about it, and they had an announcement about it.
Yeah. I think to answer your first question, I think the first question was about the flu vaccination.
Or I think this is really, is it flu or COVID?
No, COVID. This was for
Both
COVID.
Both are COVID. Yeah.
Both are COVID, yes.
Yep.
Yeah. I think, the way that we, design clinical trials are done in a way where we try to make sure that we're going to get the best data out of those trials. And so in thinking about how we group kids, how we think about kids from a developmental perspective, you have to think about things like age and body size and immune response as well. And so all of those things went into the planning of the clinical trials for the vaccines.
Yeah, and I think Hawkeye, as I understand it, the recommendation is fairly specific that if you're 11 and 364 days, you still get the 1/3 dose. Yeah. Because that's actually the specific recommendation. They took it on. They said the really important point here is to be dosed, because the reality is that if you're at 11 and whatever, there are kids like that in the clinical trial, and they still had this 90% reduction in disease, and there may be some less reduction of myocarditis. So I think that I would stick to the recommendations. When your kid's ready, you go get the dose. I wouldn't wait.
Yeah, I mean, as opposed to some sort of therapeutics like antibiotics, which in pediatrics can be weight-based dosing, or, for instance, in the monoclonal antibodies where we require a certain weight prior to even being able to receive that. For the vaccination, it's really different. We are really talking more about immunological age, and so there's really not a difference between 11 years and 10 months and 12 years and 2 months immunologically. And so I think it's important to know that, rather than depending how tall or how much somebody weighs or a child weighs, it's more important about the immunological age. And then you compare, and then you also have to take that in with the account, as we heard Dr. Jones talk about, the clinical trials and what they were able to get data for on what age groups. And so really, whatever age you are at, and if you are able to get the vaccine. More than likely, when you do turn 12, if it is in between those two dosing, you really should be getting the regular dose at that point.
Yeah, I think we just follow the thing. Just go ahead and get it done. And again, remember, the clinical trial shows the same efficacy in the 5 to 11 as it did in the 12 to 12 and up, and 12 to 16, and for the Pfizer vaccine. We don't know about some of the other things out there yet.
All right, Sally wants to know, she says this statement was included in the pre-order notice sent to physicians in Missouri. So I don't know if she works there or not, but can the doctors clarify what this said? It was, quote, the pediatric formulation of the vaccine is not the same as the adult vaccine, and the new product must be utilized for the approved age range 5 to 11 years of age.
Yeah, what they're really just saying, and Catherine can help us address this a little bit, it's really, that's about the dosing. It's 1/3 the dose versus the full dose. That's the difference in the formulation. Otherwise, Catherine, same drug.
It's the same active content in the vaccines, but one thing that Pfizer has done to really clearly mark what vial is to be used for 12 and up versus what vial is to be used for 5 to 11. They actually have different colored tops, different colored labels, but it is the same active ingredient. It's just about ease of administration to help make sure that it is the authorized dose given age.
So same vaccine, lower dose, different bottle.
Yes, but the other thing there is one other difference which is actually great. They updated the inactive, the things that make the contents of the vials stable, so that it doesn't have to be in a deep freeze anymore, which is actually great because that means we can get it to even more places and it can be shipped in smaller shipments, so it's even more widely available.
Yeah, will that be going into the adult vaccine soon as well, do you think?
I am certain that they are researching it, but I have not seen anything on that yet.
Okay, so good. That's an important point to note. I did not know that. That was good. All right.
Becca wants to know, would you recommend the vaccine for a child ages 5 to 11 who is on the autism spectrum? This dates back to a previous misinformation campaign, I believe, but would really appreciate your take on that.
Yeah, that's a great point, because I think this specific thing's been addressed, Bridgette.
Yeah, I think that, for any child that does not have a condition that's listed in the contraindication for the vaccine, which there really aren't any in the contraindication, they should consider getting vaccinated. Again, I go back to, have a discussion with your pediatrician, with your healthcare provider, but, the current data does not exclude children with autism from getting the vaccine. There's no information or inclination that these children are at any increased risk from getting the vaccination in compared to other children. So I think that this should be a strong consideration for your child, but make sure that you're having conversations with your pediatrician so that everyone can be comfortable in making that decision.
And we haven't even said the words myocarditis yet today, so follow up on that, and then let's talk about the risk of myocarditis with kids 5 to 11.
So I would just comment on what Dr. Jones said. And we do know, and I don't know as much about the disease process as Dr. Jones does, but certainly we know that some children with autism really thrive in certain environments and don't do well in other environments. Certainly if you get the infection, we know that although it is a low risk, if there is that chance of going to the hospital, being in the hospital, that is probably a pretty traumatic environment for that child. Getting needles is probably pretty traumatic. All of the things that happen when you are in the hospital is probably a pretty traumatic environment for really any child, and maybe especially one for autism. And so getting this vaccine is going to help reduce that risk as well. And so I think that's one more positive aspect, especially if we are specifically talking about children with autism. And then as far as myocarditis, what I do understand is from the small trials of these age groups, there were no cases of myocarditis nor severe anaphylactic reaction to these.
Huge deal, because that's one of the concerns about young children, especially young males, and it was really in that 12 to 24 age range. It actually wasn't just up to 16 or it went over that a little bit. But just to say, the risk of severe myocarditis and death from myocarditis is much higher if you have COVID-19 than with vaccination, where it's a mild thing and it seems to resolve quickly.
Yeah, I think that's an extremely important point, and one that I bring out with my patients a lot when this comes up about myocarditis with the vaccine. Early on there were some reports of occurrences of myocarditis, like you mentioned, in younger men. But in the pediatric data, we're not seeing that so far. But I think the thing that many people don't realize is that you have a risk of getting myocarditis with COVID. So if your child gets COVID, their risk of getting myocarditis is likely much higher. And so what we want to do is actually prevent that risk. It's not so much the risk that's associated with the vaccine.
These are really important.
The other thing worth highlighting about myocarditis and any possible adverse reaction to a vaccine is that there are very robust safety systems that are tracking all sorts of possible outcomes from the vaccine, and those will be in place for years. So we will learn more, and it has been an informed decision, but the book is never closed on data collection.
It never is. And what we're actually seeing, I think, in those who are getting the vaccination is that the myocarditis risk is there, but it is pretty darn mild because we can continue to collect that data, and we're not seeing this huge safety signal for anything that's really significant.
Right.
Mark, when you talk to populations out in the community, what are the reasons you're hearing people are resisting vaccine in these younger age groups?
You know,
And I'm talking about 12 to 16.
In the younger age groups, the conversation sort of barely started. The research that we're seeing is mostly around how parents are enthusiastic on the large for the most part about getting their younger kids 5 to 12 vaccinated when it becomes available. I think more than 50% of parents say they'll get it as soon as it becomes available. So that's great news. In terms of hesitancy overall, I think it's a combination of factors. Unfortunately, the number one reason that we're seeing in research is politicization. People's political affiliation is driving a lot of the hesitancy. In terms of the work that we've done talking to people out in the community, it's just a matter of trust. Trust is the number one thing that comes up. Some people don't trust doctors, don't trust the medical profession, don't trust the government, don't trust the vaccine because it was developed so quickly, which is frankly a misperception. It took 20 years of research to get to these vaccines. But those things are just, those things are addressable through ongoing, persistent, patient, respectful communication. It's just a matter of building trust and getting people over the objections.
Yeah. Ultimately, it's all about the trust, and hopefully we can de-emphasize the fiction. Jess.
Okay, a few more questions. Laroto says, if I have a 5-year-old with a heart murmur, do you recommend the COVID shot?
Well, I think almost even more.
Yeah, definitely. Again, there would be no contraindication there, and I agree. A child with any type of underlying condition could be at increased risk for having a severe outcome if they got COVID. But again, talk to your pediatrician, talk to your primary health care provider about getting the vaccination. But I think definitely in that situation, I would strongly consider it.
So, Dr. Stites, I have to say, I think there's still some confusion about waiting out, if you should wait a few weeks to get that full dose for a 12-year-old versus getting a smaller dose when they're that close to the age. We've just got a lot of people asking about that. Can you just help us understand that a little bit better?
Well, it's let's just be honest. This is a judgment, Hawkeye, about which way to go. Is it better to get it sooner or later? Yeah, and the reality is this: if you look at the study data, it said there's a 90% reduction in 5 to 11-year-olds of COVID, of getting COVID and severe hospitalization, death, et cetera. So if you look at that data and you say, okay, well, what was the risk reduction in the 12 with the full dose, in the 12 to 16-year-olds? Well, it was about 93%. So really, guys, those are the same numbers. Mm-hmm. And so I think the 1/3 dose in that 5 to 11 age range works as well as the full dose. Is there going to be harm because you wanted to wait 2 more weeks or 3 more weeks to get it, to get the next dose? Probably not, unless you get COVID-19 and you get really sick from it. And then you're going to say, man, that was a really bad idea. And I think that's the thing you have to weigh. There's no absolute right or absolute wrong here. It's just a question of relative risk. And if you decide, well, I'm going to wait a week, does that week actually become 2 weeks? Or what do you say to somebody who wants to wait 1 month or 2 months or 3 months or a year? Do you just wait? And what I would say to you is the risk reduction is real in the 5 to 11 and in the 12 to 16-year-old range. I would just go get the darn shot as soon as you're ready for it. Hawk?
Yeah, absolutely. As soon as you're able to, go get the vaccine. Again, there's really no difference in a few weeks on our age that we are talking about here, on the calendar date and the age. We are really talking about the immunological age, and really there's not a lot of difference. So it would probably just behoove you, especially, again, as we're getting into colder weather, we're getting into maybe traveling for the holidays, gatherings, all those things. Try to get that maximal protection as soon as you are able to, and so as soon as it's available, I would recommend going to get the vaccine.
And Catherine, if we were really going to be pure about this, what we do is say, well, let's pick the ages 8 to 15 or 14 or whatever, and let's see if there's a difference with every dose. The reality is we don't have that kind of time, we don't have that kind of population, and so at this point, you're trying, and from a pop health perspective, we're trying to do the very best to make the best recommendation we can, which is basically go get vaccinated.
Absolutely. Absolutely. And I think you highlighted well, we have efficacy data for 5 to 11 and 12 and up, and so get it as soon as it's an option for you.
Yeah, not bad for a goofy Star Trek's pulmonary guy, right? She's also married to a goofy pulmonary guy. She understands the dilemma. Jess.
All right. I actually think you made that much clearer. So I understood it. So hopefully our viewers understand it. Okay. So Isaac said he watched the FDA advisory meeting yesterday. And one of the concerns that was brought up was that there might be a vaccine overload for a kid who has already had COVID and then gets the vaccine, that there might be some various adverse effects, including myocarditis, but maybe some other things. Any thoughts on that?
Yeah, I think the key is that, yes, they had that discussion. It was a robust discussion, and they voted 17-0, Bridgette, in favor of the vaccination.
Yeah, I agree. I think, the efficacy and the safety data, are pretty clear and pretty strong. And so, we know that I think we can be confident in that data.
Yeah, I think Hawkeye, the same thing could have been said in the 12 to 16-year-old age range, and we're not seeing people drop dead from the vaccine. We're just not. And people say, "Oh, what about VAERS and this and that?"
Yeah.
No, stop. Just stop it. There's so much good safety data.
And I think there's also been, since the beginning of the vaccine, there's also been talk about that enhancement from getting the vaccine, and then if you get the infection, it's going to be much worse, and that has never played out. That has not shown to be true. That is a theoretical issue for COVID-19 specifically. So there's really no evidence that would be an issue.
Yeah. Okay, Jess, one more question?
Okay, 2 more questions. Is that okay?
Okay.
Just because, but I think about 3 or 4 people have asked this, and Janet said, should immunocompromised patients get the over 65 flu shots? People are talking about the quote senior flu shot. I'd never heard of that. So what is that, and should people be getting it?
Yeah, Hawk.
So this would be the high-dose influenza vaccine. Right now, the high dose is quadrivalent, so that's good. So it includes 4 subtypes, 2A and 2B, which is good. It used to just have 3, but now really it just has 4. So we do in our practice offer it to our immunosuppressed patients, such as HIV or people who have had solid organ transplant. So I think if you are immunosuppressed, I think it's a good idea to go ahead and get that high-dose vaccine, because we know if you are immunosuppressed, and we've seen this, the vaccine may not take, you may not develop an immune response to that.
Yeah, I think a lot of the transplant centers say go get the high-dose vaccination if you can. And
Yeah.
not everybody does, so it's interesting how it can be different. Okay, one more question.
Okay, last question. So Michael says, if gathering with vaccinated family, but he has not been in his circle for the past 18 months, should we be doing rapid self-COVID tests? Do you think that'll be really important as we start to gather with family that we haven't been around in a while?
Here's how I would answer that. If there's somebody in your family who's really immunocompromised, who are at high risk for a bad outcome, assuming everybody's vaccinated, and remember, if you've all been vaccinated, the risk for a bad outcome is incredibly small. You can do that if it makes everybody feel safer. If everybody's vaccinated, Hawkeye, I don't feel super strong about that, though.
Yeah, I think it's just one more level of the Swiss cheese that we've talked about. Certainly, it is risk tolerance and what you can do. Can you find the tests, the home tests, and those rapid antigen tests? Can you find that testing? Because we know that has been an issue as well. But I think it is one more level if you want that peace of mind. The best piece of that Swiss cheese, though, is really getting vaccinated. So all of these things combine to help reduce your risk of overall getting the disease. Whether it's masking, if you're meeting with people, meeting outdoors, doing in well-ventilated areas, things of that nature. But still, it is a combination of different things. But certainly, I think the priority and the best one is going to make sure that everybody is vaccinated.
All right, let's go around and get final thoughts from today. What a great discussion. It's been outstanding. Great group of folks. Catherine, it's Dr. Catherine Satterwhite. Talk to us a little bit about your final thoughts today.
I have 2 final thoughts. The first is to insert just another layer of cheese. Remember to stay home if you're sick. If you are showing signs of COVID, that is definitely when we'd like for you to get tested, and also to stay home, and definitely until you know the results of that test. And the other thing I wanted to share, just to support our hospitals and all the patients that our hospitals are taking care of, if you have a chance, please consider donating blood. There's actually a huge shortage right now, and it's something that as we're going into these winter months, if you have an opportunity, please consider it. It can be very helpful to loved ones that you have and loved ones of others. Thank you.
All right. Thank you very much. Mark.
Yeah, I just want to encourage everyone to get boosted for the holidays. With the holiday season coming up, booster shots are really important. They're part of that Swiss cheese. The other thing I'd say is, as we sort of scan the political landscape and we expect that a number of mask mandates will end and not be renewed around the region, just because they drop the mask mandate doesn't mean you have to drop the mask, right? Again, it's part of the Swiss cheese. Keep wearing your mask in public and get boosted for the holidays. Those are my two final thoughts.
I'm still wearing mine at the grocery store. Dr. Jones.
Yeah, I think, my message would be just to stay vigilant. We are still in this pandemic, and I think that in a pandemic, there's no individualism. We all have to band together to protect one another. And I think especially for children, as a pediatrician and thinking about the impacts that COVID has had on kids, I think it's our responsibility as adults and as a community to make sure that we can protect them the best way that we can by us getting vaccinated and making sure that kids that are eligible, them getting vaccinated as well. I did want to point out a study was published in Pediatrics earlier this month that demonstrated that more than 140,000 children have lost a mother, father, or primary health care or primary care provider from COVID. And so the impacts of COVID on kids are beyond just that of getting infected. It's having an emotional and traumatic impact on several children. And so I think we really need to think about that when we weigh whether or not we want to get vaccinated ourselves or people that are close in our households, of what the broader and long-term impact that's being had on children.
Yeah, that makes such good sense. So we have to have you back on the program. You did a great job. Write down all your thoughts. We'll call it the Bridgette Jones Diaries. I told her I was.
That's a good one.
I told her I was going to go there.
Copyright. So I think that was a great point. We see these stories every day about children who are being orphaned because of this disease process, children who are losing grandparents because of this disease process. So I think it's very important. We've talked about boosters, but I think we need to continue to endorse that message. There is a large group of the population that still hasn't even gotten one dose. We need to continue to promote that. We know that some of the misinformation topics that have been brought up have been debunked now. We know the infertility has been talked about. Well, there's a couple studies, one good recent as well, that I was talking with Dr. Weinecke and Dr. Alt about, that shows absolutely no difference in fertility rates in those that got vaccinated versus those that that were unvaccinated. We know that people are concerned about the side effects of the vaccines. But as we just heard in our show, we know that the risk of myocarditis or heart inflammation is greater if you have COVID than if you get vaccinated. We know a new published study in Nature Medicine which showed, yes, although some people who get the vaccine do get that that transient neurological disease, Guillain-Barré, at an excess of about 38 cases per 10 million doses. However, that number is 4 times higher for those people that got COVID-19. So your risk of getting Guillain-Barré is 4 times higher than if you get the vaccine. So all of these things, all of these misinformation campaigns, whether conscious or unconscious or just lack of knowledge, these are continuing to be debunked by getting good data about that. The bottom line is, even those people that still haven't gotten any dose, we need to continue to endorse vaccination for that group of people as well.
All right. Remember, I would call this the how we, what we axiom. You say, what the heck is that? How we, what we. How we do is based on what we do. And that ultimately determines how we do or where we go. All right. Thanks for being with us today. Tomorrow, recognize this face. Actor Aaron J., living his dream in Hollywood. Thought he had caught COVID-19, but quickly learned he was actually in kidney failure. Aaron found himself on a transplant list. His search for a living donor brought him back home to KCK and sparked a kidney chain. He joins us live tomorrow, along with his surgeon, director of transplant here at the health system, Dr. Timothy Schmidt, to talk about transplant in a time of COVID. Don't forget, you can watch these shows anytime on Facebook and YouTube channel. Thanks for joining us. We're back tomorrow. How we, what we, axiom. Remember that. We'll see you soon.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.
Can you hear me now?